We're here the morning after surgery with Margot. How are you?
I'm doing good.
Doing okay?
Yeah, feeling good.
So Margot is 58, and she flew in. She could have flown herself in because she's a professional pilot, but you didn't fly yourself in, did you?
No, not today.
Okay.
Not this time.
So she flew in for a deep plane facelift, deep neck lift, lower lids, upper lids, brow lift, full face laser resurfacing. Am I missing anything?
No.
Okay. And what brought you in? What made you decide, okay, this is the time?
Well, I think initially it was the mouth, really. The starting to age around the mouth, then the neck. But when I started looking in the mirror and doing this, I think I was most excited about the brow lift.
It's really funny. This is a common theme in my patients that the lower face is what attracts the attention, and then when we're all done, they're like, actually, the last lady I just posted, Charlotte. She came in for her lower face, but her favorite part's the brow lift. It's so funny. It happens all the time, and it's not because the lower face doesn't turn out well. It's just it for whatever reason the brow flies under the radar. You don't notice it as much. You see this first.
You kind of get used to this too.
Yeah, that's true too. Yeah.
You live with it for several years, and then.
So let me ask you a question. I suspect when you were younger, you had a really nice jawline neckline. Do you think in your 20s, 30s you did, or do you think you're always a little bit diagonal?
I think maybe a little bit, but I had also had that jaw surgery.
Oh, talk about that. So you had jaw surgery. I forgot.
Yeah, because I had I think it's called an overjet. So I had this brought forward a little bit. So yeah, I just had a very round face and probably a little bit of a neck, but it wasn't.
I suspect your neck's going to turn out nicer now, honestly, than when you were 30. So we'll see if that holds true or not.
Okay.
So last night you had a little bit of pain.
Yes.
Tell me about that.
I feel like I had pain because I had a lot of swelling in that area, and it wasn't going away. I was uncomfortable.
Yeah.
So I did take a Dilaudid, and then that didn't really help so much. And the recommendation from your office was take another Celebrex, and then I felt great.
Okay. Yeah. So the Celebrex, interesting, is a non-narcotic, but it's incredibly effective, and it doesn't make people as sick to their stomach as the narcotics do. So we often say instead of stacking up on narcotics, we kind of lean into the Celebrex a little harder. But I think it's important that we say not everyone has a pain-free first night. Some people have pain the first night. It's okay. Some people have pain the second night. It's a lot less common. I'd say 50-50 chance that people take the true pain pill, the Dilaudid, the first night. It's not a failure if you need it. After that first night, almost no one takes it. So half take it the first night, and almost no one takes anything but the Celebrex and Tylenol going forward. Well, turn and face me. Let's see what you look like. For day one, everything looks absolutely perfect. The incision lines look perfect. I get a lot of comments about earlobes in the first couple days after surgery. It's normal for them to be kind of bunched up and crowded. I don't want it to heal with a stretch out pixie ear or satyr's ear deformity. So it's normal for it to be kind of a little crowded the first day. Totally normal. Jawline looks incredible. Neckline looks incredible. Brow, under eye shape. This is all exactly right. Turn this way. She's got a little bit of a sleepy lower left lip. I see this about 1 in 20, 1 in 30. It wakes back up, but it can happen. I have a whole video on this, and you can look for it. Anything else you want them to know about your first day?
Obviously, everybody says this, but the nursing service is absolutely wonderful. I mean, the ladies that are hired there, they're so nice and kind. And yeah, it was pretty easy. Pretty easy, except actually, my recovery room to out was a little weird. I was really out of it.
Yeah.
So I did not expect that.
Yeah, that you were still sleepy or goofy when you got back.
Not when I got back, when I was here.
When you were here.
I was trying to talk and I couldn't speak. So that was a little bit uncomfortable for me.
In the recovery room, you're both not mentally quite awake, and we have a lot of numbing medicine in you. So like your mouth is sleepy, your brain is sleepy. It can be
a
weird moment. Yeah, a weird moment. Well, good. Well, thank you for letting everyone see what you look like today, and we'll keep up with you over the next several days while you're here. And hopefully you'll send us some long-term stuff, because that's another comment I get a lot. I'd love to see your patients at 6 months and 12 months, and almost everyone flies in. So
not only that, but I had promised you, because I can fly and it's an hour flight, I promised you that I would come back in person.
Amazing. So we're going to have a long-termer, which is great.
Yep.
Thank you.
All right. Thank you.
We are day 5 with Margot. How are you?
I'm doing great.
Yeah, you look amazing.
Thank you. I feel good.
Amazing. So we just got rid of a couple stitches on her. Upper eyelid stitches came out just now. We usually leave those about 5 days. The little brow access sutures came out. We usually leave those about 5 days. I bet you by the time you leave, it'll be almost impossible to find your brow incisions. Certainly by 3 weeks, it'll be almost impossible to find them. People kind of get worked up about seeing these right here. It's incredible. Just as a reminder, we did lower facelift, deep neck lift, lower lid blepharoplasty, upper lid blepharoplasty, brow lift, little touch of fat transfer. We'll get in that in a minute. And then a full face laser resurfacing. So you've been following along. Thank you for letting people see your journey. You've noticed some particular comments that we were just talking about. Which comments have caught your attention?
The comments about my how you gave me earlobes. Some people said that you made my earlobes look way better, and other people said, "What's wrong? What did you do to her earlobes?" But I think they look great.
Yeah. So the goal is Margot's being so kind to let you follow. But when she walks down the street, 6 months from now, 12 months from now, 2 years from now, people shouldn't just turn their head like, oh, she's had a facelift. She's had a facelift. She should be able to pass as if nothing happened as anytime she wants to. And one of the real telltales of a facelift is a pixie ear, when the skin is pulled down and stretches a diagonal tension band at the earlobe. To prevent pixie ears, I have to make sure that at this stage, 2, 3, 4 days after the surgery, it's actually almost a little crowded in that inset, so that as things relax, it'll be neutral. And so she's got a little crowded inset right now. So it looks more detached than it will when it's healed, but it'll never look pixie. At the end, it'll probably land about where you were before, maybe a little more detached.
Okay.
What was another comment they made that caught your eye?
We hadn't discussed this, but I saw a few comments. People were curious about I believe it was the netting stitching, because they were wondering why I had stitches so far down on the neck, and I don't think they realized that was the netting that came out.
Yeah, that's a really good one. So I use on everybody what are called hemostatic net sutures, and I use them just behind the ears, like right here, about somewhere between a Oreo cookie and a quarter size patch, and right here. That area is a little prone towards accumulating a seroma, or just bland, weepy fluid. So we tack it closed for 2 days, and we remove those sutures on the second day. And a lot of people, if you look back at my videos, you'll see them all the time, but people don't tend to notice them. But that area is a little prone to that issue. The other time I use those sutures, so I do that on everybody. The other time I use those sutures is if someone's bleeding briskly during surgery and they look like they're going to be a problem child and collect blood in the first couple days. I'll use that same type of suture everywhere that we operated, and I'll leave that for 2, 3, 4 days, because that's a whole different thing. That's not trying to prevent a minor nuisance. That's, I'm worried they're going to bleed. So I do that for bleeders, and I actually do that for all men. So all men get them because men are more prone to bleeding. Fat transfer. So Margot is a professional pilot. Actually, she gifted me this beautiful sweatshirt, which I'm very proud to wear. And she had, like most of my patients that live here in the US, more sun damage on the left side than the right side, but maybe even a little more. Do you get more when you fly? Are you close to the less on the left, or is it the same everywhere?
I'm on the left side.
Yeah.
Yeah.
And so she had really, really specific sun damage. You could see it, and I'll show you her photo, in the left buccal cheek, this lower forward cheek just behind the jowl. And so as long as we had fat in our hands and we were using it for the under eyes and everywhere else, fat is very regenerative. It's very restorative. And so I actually planted some of that under the particularly sun damaged skin. Yes, we laser the surface, but if we can nourish that a little bit better, we can maybe catch that back up. What else do we need to talk about? Tell them how you're feeling. So you took pain pills the first night.
Yep.
Since then,
the Celebrex, I had to take double the Celebrex for a couple of days, and then back to the normal dose. And then, I mean, there's really no pain. A little pain in my face, but nothing that I need any medication for. I feel good. There's the usual, I'm swollen. There's pressure, tightness, a little bit of this like under the chin, like somebody's grabbing you, that comes and goes. But really comfortable, bored at the hotel. That's probably the hardest thing. And I was just telling you, for people coming in future for surgery, my lovely neighbor, I was complaining, and she sent me a link for a gooseneck tablet holder.
oh,
that you can have next to your bed to hold your tablet, since you have to lie flat, because I actually was watching my phone and I dropped it on my face.
Well, if you broke your nose, I got you.
Okay. But yeah, that's anybody coming in for surgery, make sure you get one of those if you want to watch any TV, because you have to lie flat. So
Perfect. Good. And last thing I'll mention, a couple people asked if she got a chin implant.
that was it.
And the answer is no. No chin implant. She has a beautiful jawbone just as it is. It was just kind of hidden by a veil of soft tissue. So just by revealing her existing jawbone, you see her beautiful bone structure. So that's it. Thank you for letting people follow along on day 5.
Thank you.
We look forward to seeing you in another couple days.
That sounds great. You're awesome.
Hi, my name's Kelly. I'm one of Dr. Nayak's nurses, and I'm here with the famous Margot. You are, I think everybody says I've been watching her, so thanks for sharing. Margot is about 1 week out from surgery now, right?
Yep.
And
Day 7.
Day 7, halfway through your restriction part. So we did a facelift, necklift, brow lift, upper eyelids, and full face laser, lower lids, full face laser.
Yep.
We get it all.
I know.
How are you feeling now at about a week out?
Yeah, I feel really good.
Feeling good?
Yeah.
What's better now than was for the first day, like as far as tightness and things like that?
The swelling is going down. I feel just a lot more normal. There's still some tightness, but I just feel good.
Yeah. Feeling good, looking really good. So, and are you staying inside? Or are you getting out a little bit?
I've had a few walks outside. It's a beautiful neighborhood at the residence inn around there. It's absolutely beautiful.
Yeah.
Nice treadmills. So I've been getting the steps in.
Okay.
But trying to stay inside, just avoid the sun.
Yeah.
Yeah.
It's a hot time of year here in St. Louis. So it's a good idea that you're doing that. You can go out, big hat, glasses, cool, evenings when it's a little cooler, take some walks.
Yeah, and the last few days have been beautiful. So yeah,
good.
Trying to get out.
Good. I'm glad to hear that. What are some things that maybe you wish you'd known at this point that maybe people are asking online, or you want the opportunity to be able to share?
Well, Dr. Nayak and I had talked about this, and we forgot to say it on the video the other day. I always assumed that when Dr. Nayak did these videos that he would do all 10 days and save them and then post them. But he basically posts them the same day or the next day.
Yeah.
Which is pretty amazing. I mean, that's total confidence. So
that's right.
Anybody was to have some kind of complication, you're going to see it.
Right.
So
right.
My surgery was on Monday, August 5th.
Yeah.
And we're at the 12th. So this video will probably be out tomorrow.
Probably. He's pretty on it. In the past, if you haven't had yours posted right away, or if that would change in the future, it's usually a time thing. It's him. He's doing all the editing himself, doing all the things himself. So if you ever see a delay, it's just a time thing. So yeah, he likes to share everything. So, okay, well, let's have you, what does he have you do? Turn towards me and let him see what you're looking like there. You can kind of see a side view. Amazing shapes already. Her skin's already peeling. So day 7, she's got a little bit longer to go on that, and then she'll be done doing that. Perfect. All right. Well, thank you for sharing your story. I know everyone appreciates it and enjoying watching your journey.
Yeah, thank you so much.
Thank you.
The people who take care of us are wonderful.
Oh, you're sweet. Thank you.
We are day 10 with Margot. How are you?
I'm great.
Yeah. I just want to say you've broken the internet. People, I feel like they're all like rooting for you. It's incredible. Have you noticed how many people are like, you go? I'm so it's incredible.
People have been incredibly kind and wonderful. It's been nice reading everybody's comments. They've been so sweet.
Yeah. Of course, there's the occasional troll, but that's modern life.
Those are funny.
That's modern life. Oh, my favorite one. It's like I take it as a compliment. Is like, and they love to write it in other languages, thinking that you can't hit the translate button or they don't understand. That's not the same lady.
Same person. Yeah.
Look at her eyes. Look at her ears. She's totally different. What kind of fools do you take us for? It's my favorite one.
Yeah.
Are you the same? Are you the same person?
I think so.
So she's day
a better
10.
version.
Yeah, day 10. We did the deep neck lift, deep plane facelift, under eyes with a little bit of fat transfer, just tiny bits. Full face laser resurfacing, upper lids, brow lift. You told me you're starting to tell me. I said save it for the video. You're starting to tell me that yesterday you had a kind of mental, emotional pothole. That was day 9. Tell us about it.
So I really didn't have any physical pothole. Day 4 was probably the worst with swelling and everything, but I always had energy, felt good. Yesterday, I just, I woke up I actually looked at Instagram and I saw that you had posted another little clip. And my first reaction was, oh my God, I'm so sick of seeing my face. I'm like, everybody's got to be so sick of me, you know? So, and then the rest of the day, I was just very irritable, very like, I look weird, I feel weird. And I knew that it was a post surgery thing. I knew, I'm like, just wait till tomorrow. You're going to wake up, feel fine. I even literally said, if Dr. Nayak asked me to do a video tomorrow, I'm like, I'm not going to do it. I'm not going to, because I was just, just kind of feeling, I guess, drained. And then I woke up this morning and I feel great. I feel good again.
And that's, I'm going to tell you, she's one of my very healthiest, one of my prettiest results. And even you had a bad day.
Yeah.
So those of you going through this in the future, when you have bad days, think back, because what I've noticed is people,
I expected it. People, you always ask people if they're scared before surgery. I wasn't scared of surgery. I wasn't scared of, you're so talented. I expected a great result, but I was a little bit scared of the, whenever you have a cosmetic surgery later on emotionally, you're going to kind of go through it. But I think you did a great job.
Well, thank you.
I'm very happy.
Thank you. So yeah, the last thing we're talking about is it's kind of bittersweet. On day 10, it's like we've been seeing each other. How many days out of the 10 days did you come into the office?
Oh, I'd say at least 5.
Oh, I'd say maybe more than that, because we do
Day 2,
checkups
3,
on day 1,
5, 7, and 10.
1, 2, 5, 7, and 10.
And
then we do the manual lymphatic drainages. So most people are hearing at least 7 times in the 10 days. And so, they start to get to know the cast of characters. And so we're going to miss you. And I've had a lot of people it's bittersweet, but you get to go home, you see your family, see your animals, all that kind of stuff.
Yep.
So, well, thank you for being here and letting everyone follow your journey. Anything else you want to tell them before we let you go?
I need a big hug.
You're amazing.
Thank you.
I hope you found this information helpful. If you did, hit that subscribe button and turn on the notification bell icon so you can see my future content.